All right, we are taking you back to Durban now to get an update from the International AIDS Conference. We cross back to our reporter Blaine Herman, who's standing by.
Yeah, Natasha, there's over 6 million South Africans that are living with AIDS, and that's about 11% of the population. But there's a particular group that are of concern to health officials here in South Africa. That's young women and girls between the ages of 15 and 24. But there's new evidence now that actually shows why this grouping is high risk. Now, let's further this conversation and find out what's this new evidence. Professor Ayesha Kharsany is a senior scientist at CAPRISA, which is the Center for the AIDS Program of Research in South Africa. Professor, thank you very much indeed for your time. Tell us, firstly, this new evidence. What is it?
Thank you very much, Blaine. So just to give you a bit of background, CAPRISA is a research organization. We focus on both HIV and TB research, which are the major killers of our communities, especially in this setting.
Yeah.
So the new evidence that we found is that we've conducted three major studies, and the first study was conducted within a research within rural KwaZulu-Natal, both rural and peri-urban areas, and we sampled just around 10,000 individuals, and we found an extremely high prevalence of HIV. And we tried to understand this more specifically, where we looked at the genetic coding of these infections. And so we tried to look at the phylogenetic analysis of these infections. And what we did...
First, what is phylogenetic analysis?
It's looking at the HIV at the molecular level.
Right.
And when we examined these sequences, we found that there were a number of individuals that had linked sequences. Now, why is this important? Is that for many years we've been looking at age-disparate relationships, which actually contribute to HIV infection. But this was the first time where we looked at, in this setting, where we looked at the genetic linkages of infections amongst men and women, especially amongst those in the younger age groups, and we found at least 202 linked infections, and these were about 123 males, and the rest were women as well. So what these infections showed, when we examined these infections, it showed us that the linkages between men and young women, where do young women acquire the infections from? So when we examined these linkages, it was young women between less than 25 years of age acquired infections were linked with sequences from men who were much older, at least 8 to 10 years older than themselves. And so this gave us some key information in terms of where young girls were acquiring these infections. But what happens is that these young girls subsequently become much older females, and as they become older, the prevalence increases, and they contribute to infections in a circular form to older men as well.
And I see this is why people are against intergenerational sex, isn't it? How does this shape our approach now going forward?
So I think it's important that we try to understand in what context these infections are occurring, what kind of relationships are occurring, and we also need to try and inculcate within our general populations what are the risks of infections being acquired from older individuals as well. So this is what we're trying to understand. We're trying to understand more at the behavioral level, at the social science level, what are the factors that will contribute to these age-disparate relationships as well.
So this group is obviously now in sharp focus to get the awareness out there, isn't it? Education is key.
Absolutely. Education is key. We need to address social issues like poverty. It's possible that young girls engage in sex in transactional sex for multiple reasons, etc. And so we need to understand in what context these disparate relationships are occurring as well.
How do we effectively communicate this to this age group, these youth? Because they're vulnerable. Do we use their tools in terms of social media, trying to engage with them directly? How do we actually do that?
I think social media is a critical tool, especially for the younger populations, especially for our younger individuals. And I think it's a tool that we need to make it more easily acceptable to the older people to be able to realize and to be able to inculcate within the younger people as well in terms of what's happening.
Yeah.
What we also try to do is that we also look at whether what kind of applications young people would be using to be able to engage in, to be able to receive this information, receive the messages that will bring and will shape their lives as well.
Yeah.
And I think apart from those tools, there are a number of factors that we need to look into as well.
Lots of work still left to do. Professor Ayesha Kharsany is the senior scientist at CAPRISA. Thank you very much indeed for your time. Great work finding new evidence in terms of why young women are actually at a higher risk. Still lots to come from the 21st International AIDS Conference. Stay tuned to Channel 404. But for now, it's back to Johannesburg.
Thank you very much. And as he says, still lots to come from the conference. We will be tracking all of that for you. Blaine Herman, thank you very much.